Today, presented by the Bonati Spine Institute, the world leader in advanced spine surgery, featuring the internationally acclaimed inventor of the Bonati spine procedures, Alfred Bonati, MD.
Hi, I'm your host, Kimberly Brumell, and welcome to American Medicine Today, brought to you by the Bonati Spine Institute. Every week, we inform you about breakthroughs in medicine, educate you on the growing concerns medical professionals, politicians, and experts alike have about Obamacare, and highlight the work of Dr. Alfred Bonati and the Bonati Spine Institute by sharing some of our patients' miraculous recovery stories. Today's show will begin with an interview with my American Medicine Today radio co-host Ethan Euchre and Dr. Christian Drehsen, founder and director of Clinique of Plastic Surgery in St. Petersburg, about cool-sculpting, a non-invasive alternative to liposuction. Next, we'll hear from Master Sergeant Michael MacDonald, one of our Help for Wounded Warriors recipient who underwent a complimentary Bonati spine procedure with world-renowned orthopedic surgeon and founder of the Bonati Spine Institute, Dr. Alfred Bonati. We'll hear about Michael MacDonald's remarkable recovery from him personally and the medical staff that assists Dr. Bonati in treating these patients in our Back to Life segment. To follow up, we'll speak via Skype with retired soldier Lieutenant Colonel Steve Russell, who is currently running for the U.S. House of Representatives in Oklahoma, about the troubles that are continuing to plague the Veterans Administration. Then we'll speak with Dinesh D'Souza, New York Times best-selling author and critically acclaimed filmmaker of America, Imagine a World Without Her. We interviewed him from the News Radio 970 studios for our radio program, American Medicine Today, which can be heard Saturdays at noon. We'll speak with Dinesh about the movie that questions the shaming of the United States through revisionist history, lies and omissions by educational institutions, political organizations, Barack Obama, and other progressives to destroy America. Finally, we'll hear from Florida Senator Alan Hayes, who is trying to get this movie into our classrooms by introducing legislation to make it required viewing in over 1,700 Florida schools. Introducing our first guest is radio and program executive producer and co-host of American Medicine Today, Ethan Euchre.
Thanks, Kimberly. Every Saturday at noon, we are joined by interesting guests who shed light on the growing concerns many Americans have about their medical care. The patented Bonati spine procedures are leading the way in minimally invasive spine surgery exclusively performed at the Bonati Spine Institute. Now, a recent 7.5-year survey shows a patient satisfaction rate of 98.75%. Dr. Bonati dramatically changed the way conventional spine surgery was performed. Now, our first guest is Dr. Christian Drehsen, board-certified plastic surgeon. He is also the founder and director of Clinique of Plastic Surgery in St. Petersburg, Florida.
And we sat down and talked to him about cool-sculpting, a new non-surgical alternative to liposuction. We're here with Dr. Drehsen, and he's a board-certified plastic surgeon and founder and director of the Clinique of Plastic Surgery. He's here to talk about what's called cool-sculpting. So Dr. Drehsen, explain what cool-sculpting is and how it can help those that don't want to undergo surgery necessarily, but they want to look more in shape.
Cool-sculpting is a non-invasive liposuction, basically. So it's based on the principle that if you freeze the fat, the fat cell will die. So they picked exactly the right freezing tool so that it doesn't damage your skin but freezes the fat. The major advantage of that is obviously there's no surgery, there's no downtime. I mean, you can come from work and go back to work right after that. It's a great procedure because for the people who work, they can come into the office 1 hour later or an hour and a half later, leave back to work, and really there is no sign of having had a procedure.
It's very minimally invasive. I love the feeling of it, knowing that you don't have to go through medical procedures, anesthesia, any of that. You just lay here for an hour and you'd be done. You could take a nap.
While I was having the treatment, I just took out my iPad and finished some work, talked to my husband.
How many treatments do you feel is necessary for someone to receive optimum results, at least in one area?
Yeah, if you talk about one area, I mean, one area in general means two areas because you go one hip and then obviously you have to do the other hip.
Correct.
But so one treatment is enough to see a substantial reduction. Some people come with multiple areas, obviously. Therefore, every single area is basically 1 hour of treatment. But once again, the advantage is that there is no downtime short of that little immobilization for 1 hour.
Correct.
You don't have to go to a hospital, you have to be put asleep, you don't have anything that bleeding and this and that. And for some people, especially people that are very sensitive to the idea of having surgery, is a perfect method, yeah.
And no scarring.
No scar.
Now, how long from the time you have the procedure to when you actually see the results? Is it something like that immediate?
No, it's about a month. It takes time for actually the fat cell to break apart. Having been frozen, they break apart and your body scavenge all that thing and basically get rid of it. So it takes about a month to see the result. Yeah.
And who is the sort of ideal candidate for cool-sculpting? You can't treat someone who's morbidly obese.
No, absolutely not. I mean, the ideal candidate is somebody who was about a normal weight, essentially what we consider a normal weight, but as a role. I mean, for men it's usually the love handle, for women it could be the love handle, could be sometimes place like the inner thigh, some be a place like the outer thigh.
And you're saying the application takes about an hour long?
About an hour. It's about the whole process is about an hour. About 45 minutes to an hour.
And so what happens to the fat after it's frozen? And it's not uncomfortably cold having that on your skin?
It warms up
freezing
fairly
the fat?
quickly. So what we do right now, after completion of the treatment, we do a massage of the area, and the area almost feel like a piece of cold butter. So you massage it in. As you massage it in, it actually improves the damage to the fat and improve the result.
It's great. It doesn't hurt at all. I've been here almost an hour just on this side.
When I first had the applicator applied, I felt a little bit of tugging and pressure, but that soon went away. In 5 to 10 minutes, I was numb. Honestly, the treatment was amazing. I didn't really think it was going to be so easy, and I definitely do it again.
And so how does the body get rid of that fat
Well,
after
the body
it's dead?
basically is a bit the same idea as defreezing a piece of meat from the refrigerator. If you let it bleed, you see it bleeds out because a lot of the cells explode. And basically, as a fat cell explode, by definition, they are dead. So your body scavenge all the debris of that fat and get rid of it.
But it's definitely not anything you'd want remotely near the face.
Yeah, they're actually doing an applicator now that can be used for the neck as well. So yeah, so there is a variety of applicator that are in the design process now to respond to the different area in the body.
So if somebody was interested in the cool-sculpting procedure, what are the steps they would need to take?
But the first step would be eventually to call us at the Clinique of Plastic Surgery and then ask to speak to the person in charge of Coolsculpting program, and she can then give you all the information, including try to accommodate your time and be put on the program. So it takes very little. Technically, we don't need any lab work. It's basically applicable for anybody in any kind of medical condition because there's relatively no contraindication to Coolsculpting.
And how could they contact you?
Well, you can contact us by phone, which is 727-592-0991, or on the website cliniqueps.com.
At the Bonati Spine Institute, all of the procedures are performed here at our 11-acre facility, from your initial consultation and exam to x-rays and MRIs in our on-site imaging center. All of our surgeries are performed in one of our 3 surgical operating rooms, and recovery is just steps away. This allows the surgeon more access to their patients and allows you to go home the same day. We'll be right back to hear from Bonati Spine Procedures patients benefiting from our Help from Wounded Warriors program in our Back to Life segment.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
Welcome back to American Medicine Today, presented by the Bonati Spine Institute.
Since working with Dr. Bonati and the Bonati Spine Institute, it always amazes me when we receive cards and updates from patients even years after their surgery, telling us how they're doing, sharing heartfelt stories and milestones that were completely unimaginable prior to receiving the Bonati spine procedures. This update is from Wounded Warrior Master Sergeant Michael MacDonald. Now, Dr. Bonati regularly reaches out and performs complimentary surgery for the ones who put it all on the line for our freedom, with help from our Help from Wounded Warriors program. This wounded warrior was able to return to the military and is one of our many back-to-life success stories.
I was in such pain from years and years of being in the military, over 20 years, jumping out of airplanes, rucking with large weights on my back, had just taken its toll. I had horrible sciatic pain, and it was actually affecting my career and my ability to do my job.
We're very happy that we're able to help him, but at the same time, that type of people is the people that they succeed in life, and is the people that get better.
I was seriously considering having to get out of the military earlier than I wanted to, simply because of this issue. If I didn't have pain on a day, that was a great day, but 2 out of 3 days, I was living in pain and just suffering with it. And thanks to the doctor, I don't have to anymore. When I went to the Bonati Spine Institute, I walked in, I felt like a professional athlete, professional quarterback in his very own private clinic. That's how they made me feel. He's very interested in you as a person, and wants to know. He came in, he told me, when he was looking at my pictures, and he was like, you have pain here, you have pain here. And I was like, yeah, absolutely. And he was a doctor, I'd been to others, but he was a doctor that didn't want to fillet my back open like a fish, and do like open spine surgery, because everybody else wanted to do that and I was not having it. He promised me, he's like, you'll be pain-free. He kept his promise completely, 100%. He performed the surgery. The anesthesiologist who was working with me, who was like basically sitting right there, and then I was watching on the monitor everything that the doctor was doing inside my back. He was a Naval Reserve officer, so we talked a little bit about that. I mean, I was like having a conversation with this guy as the Dr. Bonati is fixing my back. Every time he was getting ready to, I wouldn't say hurt me, but dig in there, she would rub my feet, and I knew it was coming, and that made me feel so good.
It's always exciting to see the response of our patients, to be a part of that experience. It's I'm just there to help and make the process easier for them, but Dr. Bonati makes the magic.
My sciatic pain disappeared. I was up walking that night after the surgery, moving. Not super well, but I was moving, and it was really good. So, in seeking out the doctor, it was one of the better decisions that I ever made.
It feels terrific to help the Wounded Warrior veterans. This is a group that has proven themselves. They're most worthy of extra effort on our part.
It's been about 1.5 years, and I am still doing my thing, still in the military. Thanks to Dr. Bonati. Really do appreciate everything that he has done for me. I just recently went and received my CrossFit level 1 trainer. I never would have been able to do that 1.5 years ago. I know that, and thanks to Dr. Bonati, I was able to do it. I actually reached out to him. I sent Kimberly Brumell, she's a wonderful person, as are all of the doctor's staff. Sent her a message just letting her know. Just like, hey, this is what I did, and just pass along to the doctor, say thank you for me. I really appreciate it. They don't have to live in back pain. If you've tried everybody else, then try the best. Go to Dr. Bonati. At least let him look at it, because he'll tell you. He'll give you the straight up, if he can fix you, he will. He reaches out to wounded warriors, to veterans, and brings them in and helps them. He doesn't just let them sit there and be in pain. He's a very caring individual in that manner. Thank you for allowing me to continue growing in my life as a husband, as a father, helping me continue to serve my country. Thank you for helping me be pain-free.
This is the first time that I am pain-free after 18 years, and it's just wonderful. I love it.
Phenomenal results, no pain whatsoever.
My pain is virtually gone, nothing short of a miracle.
Those surgeries gave me my life back.
Already I feel like a new person.
I'm going home new. I can chase my grandbaby now, I can garden, I can cook, and I'm really thrilled. The outcome has been remarkable.
I feel 100% better.
It's like a miracle.
It was phenomenal. It literally did change my life.
I was in a wheelchair at that time, and I left here walking.
Every single pain that I had when I came here is gone.
I'm ready to go home and feel great. This place is great. Thank you.
Everything that they said they would do, they have done, and I'm very, very satisfied and happy with those results.
I knew in surgery, in fact, I told the surgeon when he relieved the pain off the nerve.
The pain is gone. I'm feeling wonderful.
I have no pain. I feel better than I felt in 4 years from the surgery. It was almost immediate relief.
Today I am totally pain-free, which is just amazing. It's fantastic.
It definitely works. I mean, I really don't know what else to tell you. I'm happy.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
Our next guest is Lieutenant Colonel Steve Russell. His unit played a major role in the hunt and capture of Saddam Hussein, and he's been featured in many TV programs relating to that experience. He's now retired from the military and is running for the U.S. House of Representatives in Oklahoma.
Now he has taken up a different fight, protecting vets like himself with our own Veterans Administration. We spoke with Colonel Russell about the problems facing the VA today and what needs to be done to get our troops the help they so desperately need.
Now, I understand, Colonel Russell, that you've been pretty close to this whole scandal. Used to be a part of the Concerned Veterans of America. Now you're actually running for Congress in Oklahoma. So speak a little bit from a military standpoint of how you got involved in this scandal and what it means to you as a veteran.
Well, I think any of us that have been closely advocating for veterans, you can't advocate for veterans without bumping into the VA issues. Is something that's very, very important. And the VA, it is supposed to be care that is there for our veterans. We have a lot of issues with it, largely wait times, distances. You're talking about not being able to fire your senior managers, bonuses going for non-performing senior level managers. The list could go on, but these are some of the big issues that have to be addressed in any accountability act currently before Congress.
There's a problem with these upper management getting these huge bonuses.
What a lot of people don't realize is that these senior executive service personnel are unable to be fired by the VA secretary. Whether or not any president appoints them, they do not have the authority currently under law to fire these executive managers. That's unacceptable. If it were a private entity or private health care, then it would certainly remove non-performing people. Instead, in our bureaucratic system, they get bonuses.
No matter what type of safeguards you put on or what new laws that are passed, with the same management, isn't it still going to be as corrupt as it is now?
If you have a new VA secretary that is able to come in, like we see the current one. He was the former CEO of Procter & Gamble. He certainly has a lot of experience, the one that's been nominated. And so he probably has a good idea about non-performing regional managers. Right. If he has the authority extended that heads could roll for non-performance, I guarantee you people will either shape up or ship out.
The money that they spent on the raises for the management, if they had dedicated that to actually helping the veterans, I think a lot of the scandal that we're seeing would have fallen by the wayside. I don't know your thoughts on that.
Too often people think that this is a money issue, and if we just throw more money at the problem, it will fix it. And we've seen that that is not the case. In fact, the VA budget increased by hundreds of millions of dollars in the last 15 years, and yet we've not seen the care improve. In fact, we've seen scandals. So it's not a monetary amount per se. It is proper organization and proper leadership of the VA. That is paramount.
Lieutenant Colonel Steve Russell, good luck in the congressional race down there in Oklahoma. We wish you the best of luck, and we appreciate you joining us on American Medicine Today.
When we return, we'll speak with Dinesh D'Souza, New York Times best-selling author and critically acclaimed filmmaker of America. Imagine the world without her.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
We interviewed Dinesh D'Souza from the News Radio 970 WFLA studios for our radio program, American Medicine Today, which can be heard Saturdays at noon.
We will speak with Dinesh about the movie that questions the shaming of the U.S. through revisionist history, lies and omissions by educational institutions, political organizations, Barack Obama, and other progressives.
You know, I'm an immigrant, and I remember that first feeling I had of America when I first came here at the age of 17. That feeling has never left me, and I think it continues to define the spirit of America, the sense of possibility, the abundance that is enjoyed by the ordinary man, the idea that you can be the architect of your own destiny. So I've been kind of stunned to see over the years the ways in which there's a kind of progressive leftist critique of America that's not just in politics, but has now ensconced itself in schools, in colleges, in the media, in Hollywood. And so my film is a kind of course, I air that critique. I let the leftists rail against America, but ultimately I want people to leave the film falling in love with America all over again and wanting to fight for America.
A Florida State Senator here, maybe you want to elaborate on this one, Kimberly, Alan Hayes.
He was so impressed by your movie that he said he wants to introduce a one-page bill later this year, and the bill actually states that students in 1,700 Florida public high schools and middle schools are to be shown this film unless their parents object. And I think that's an absolute must, because right now you have the far left, and a lot of their books are being put into the school system, and it's mandatory reading. And if you're going to show far left viewpoints and things that aren't true about history, it should be mandatory that your book and or your movie is presented as well.
Well, you know, when I first heard about this, I flinched at the word mandatory, but then I realized, wait a minute, this isn't college. In school, everything is mandatory.
Correct.
You know, it's not like you have options about what courses to take or what books to read. The school decides, you know, either they show Michael Moore's Fahrenheit 9/11 or Al Gore's An Inconvenient Truth, or they don't show it. If they show it, everybody watches it, unless their parents write a letter. And so this Florida legislator is doing nothing other than what's happening in the schools anyway. And what he's trying to say is, look, if you're going to get one perspective, if you will, the shame narrative, as I call it, America, the inexcusable, isn't it nice to hear from an immigrant the other side of the story?
For our final segment, Dr. Bonati and I reached out to Florida Senator Alan Hayes, who's trying to get the movie America into our classrooms by introducing legislation to make it required viewing for 1,700 Florida schools. We'll now show you a promotional trailer for the movie to encourage you to see this impactful and educational film.
We're living in the American era, but this moment of American triumph is very fragile.
Of course, we can say thievery was a critical element to the expansion of American empire and the establishment of the American way of life. Of course.
The settlers came in, drove out, exterminated the native population. That's one of the two original sins of the society.
The other being slavery?
The other is slavery.
Reagan had called the Soviet Union, you remember, an evil empire, and the Soviet Union is dissolved. So who's the new evil empire?
Well, you're sitting in it.
How badly we need right now a Washington, a Lincoln, a Reagan. Well, we don't have them, but we do have us.
Dr. Bonati and I are here to speak with Florida Republican Senator Alan Hayes. Now, the movie America came out by Dinesh D'Souza, Imagine a World Without Her. And you are trying to put forth a bill that is going to make mandatory to 1,700 schools, high schools and middle schools in the state of Florida, mandatory to watch this movie. Why don't you tell us why you decided to do that?
Well, my wife and I went to see the movie, and I came out and I said to her, I said, you know, every school student in Florida needs to see this movie to get a more informed picture of American history. And I thought, why not go ahead and do something? So I checked with the bill drafting and asked them to come up with the language, and we decided to make it mandatory for all 8th graders and all 11th graders to see the movie once a year, unless their parents send a note to school asking that the student be excused. It's just really quite simple.
Why do you think that other senators and other congressmen haven't banded together and said that the second this movie came out?
I would only expect that they haven't seen it, but I really don't know. I haven't talked with any of them about it. I did have a legislator from Texas yesterday called and wanted to know if I would share the language of the bill with him. I said, sure. So he's going to try to do it there in Texas. I don't even know what his name is. My office staff handled the whole thing. But that's so far the only legislator that I've had in contact with that said they'd like to do it.
We will try to see if we can gather some other legislators in the area and ask these questions so we can help you to accomplish this enormous, important task that you just created. I'm so proud of you. This is exactly what this country needs.
Thank you for watching American Medicine Today. If you have any comments or questions, please feel free to contact us at the number below. Or you can tweet at Dr. Bonati or hashtag American Medicine Today. We respect your views and opinions and would like to hear from you.
Thank you for watching American Medicine Today, presented by the Bonati Spine Institute. Please look in your local listings for our next regularly scheduled program. To hear more from Dr. Alfred Bonati and American Medicine Today, tune into News Radio 970 WFLA.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.